Thank you.
Senator Kroger.
Thank you, Mr President. Mr President, I rise tonight to raise serious concerns that are faced by many, and I would suggest all Victorians in Australia. The one thing we know is that the Australian public has wisened up to a couple of things about the Labor government, and that is that its answer to every public policy challenge seems to be to throw money at it. It can't control its spending, and it's shameless the way in which it demonstrates no accountability in keeping its promises and the pledges it makes. And to be quite frank, I'm sick of it, Victorians are sick of it, and I have to say all Australians are over it. In the last 3 years alone, we have heard from front and backbenchers alike in the government, with the constant spin and rhetoric engaging in most impressive theatrics, I have to say, here in the Senate about the government's so-called ironclad commitment to a budget surplus in 2012-13. We all know, of course, what happened to that promise. Another pledge junked in that bottomless bin, that bottomless pit of policy pledges that must exist in the Prime Minister's office. And we know we can't believe a word they say about the budget and the state of Australia's finances, because there's history here, and the history exists since this Gillard government was elected. You don't have to speak to many widely outside the corridors of Parliament House to appreciate the extent to which this government's economic credibility has been shredded. As a consequence, the government is desperately seeking measures across many portfolios to plug the financial black hole, and I have put on the public record here and in Senate estimates many times my disgust at the way in which the government has slashed the defence budget, just taking one portfolio as an example. Whilst the ADF are under increased pressure to do a lot more, particularly in protecting our borders, and we know that they have done an amazing job in assisting with disaster relief only this year alone, they're doing this with a budget that has essentially been slashed by a third. And the long-term implications for our military and our national defence versus the short-term expediency approach by this Gillard government, I think, is an absolute disgrace. But I wish to, in the few minutes that I have, turn to my home state of Victoria, where cuts to the federal budget are not just theoretically hurting families, but where it is effectively depriving them of essential services in their immediate communities. The Gillard government's decision to cut funding to public health services to the tune of $107 million has severely impacted the Victorian health system. The biggest impacts have been felt across eastern and southern health services in areas such as Lilydale, Maroondah, Box Hill, Monash, Moorabbin, Casey, Dandenong, Wantirna, Blackburn, Clayton and Burwood East, where my electorate office resides. More than $8.4 million was cut from one hospital, Maroondah Hospital alone, and as a result of that, beds have been closed and elective surgeries have been postponed. Statewide vital services have been withdrawn and staff numbers have been slashed. And this is an absolute disgrace that we actually should not allow the government to get away with. And I cannot believe, and it's a great disappointment, that there's no Victorian Labor senator sitting in here tonight on a Thursday night, clearly on the plane home, that there's no Victorian Labor senator here, because they should be ashamed of what has happened in Victoria and the consequences of the slashing of the health budget. Mr President, Senator Collins, my colleague in this place, has an electorate office in Box Hill, not far from mine. Just under 10,000 residents live in Box Hill, many of whom will note the damage that health funding cuts have done to their local hospital, but more to the point, many of them who have picked up the phone and called my office to say, can you do something about this, because we're not getting a response from her office. In 2010 to 11, Box Hill residents had to wait 46 days longer than the national average for elective general surgery. This is no fault of the Victorian Liberal government, notwithstanding what we have heard and the defence and the rhetoric from the federal government. It is not the fault of the Victorian Liberal government, who since their election in 2010 have increased funding for Eastern Health Services by almost $10 million. The residents of Box Hill have been severely let down by people like Senator Collins and the member for Chisholm, Ms Anna Burke. I have to say that I have been very proud to work side by side with our Liberal candidate for Chisholm, Mr John Newen, who is talking to many in the Chisholm community about the things that are affecting them and how this budget cut is really, really hurting their families. And his elected office in Mount Waverley, like mine, has been inundated with calls about this very issue. Southern Health Services have been severely impacted by the cuts and have been forced to close a 28-bed ward in the Monash Medical Centre in Clayton. 28-bed ward. Eastern Health Services have been devastated so badly by the funding crisis that they have closed a Blackburn-based mental health program. So they've actually slashed the program because they can no longer afford to sustain it and support it. And they don't know if and when they will be able to resume what is a vital service for the area. Mr President, it is a deep tragedy that public services on which so many Victorians and people rely have been cut in such a detrimental way. But I have to say the same situation also exists in Deakin, where the member is Mike Simon. We have a great candidate there in Michael Suka, and he also, with me, has been hearing the same thing in Deakin. There is a consistent message across the south-eastern corridor of Victoria on the outskirts of Melbourne, and the consistent message is the way in which these health cuts are really, really hurting and impacting on families and in hurting their children. And it is just a disgrace. Yet, what have we heard from the member for Deakin, Mike Simon? What have we heard from him about this? I have to say, and I have looked in the papers, I have followed the papers, but I hate to say not too much. I don't think we've heard a peep from him about it. More than $8.4 million has been taken out of Maroondah Hospital's budget. And as I said, at the same time, Box Hill Hospital and Maroondah Hospital are facing cuts, and they also are picking up the pieces from other hospital closures. So they're impacted by more people going to their hospitals because of the closures of other services in the region. Non-urgent pathology tests are being sent to these hospitals for processing, but this in turn compromises the safety of patients. It takes time for transportation to the pathology labs, for diagnosis and for treatment. It is actually extending the whole time process, and something, when we're talking about essentially life and death issues in many cases, it's something that I just think is unacceptable. In Chisholm and Deakin alone, not only the cut's been extraordinary, but I have to say that across the state of Victoria, I've been advised that there have been some 350 bed closures. So the question does remain, very briefly, the question remains, yes, through political pressure, the government did put back in what they took out, some of what they took out, which was $108 million back into the system. But there is no guarantee of what's going to happen after 30th of June. There has been no indication of how this is going to be addressed from the 1st of July on. What programs will have to be cut still? The hospitals, the health service providers, they still are in no man's land as to how they are going to run their health budgets. It is a crisis that continues in Victoria. It is one that demands immediate attention, and I urge the government to address it.